Well, my story might be a little bit different. About, let's see, 18, when I was 70 years old, I was diagnosed with prostate cancer. That was before I knew about the Revisi treatment. So I had high numbers, so I went ahead and had a radical prostatectomy. And everything was sort of okay after that, except several years ago there began to be hints of it coming back in that area, even though my prostate was gone. So at that point I heard about the Revisi treatment, and I went to them, and they looked at my numbers, my PSA numbers, that they will get those down, and they gave me the treatment with the medications, which were non-toxic. I had no reaction one way or another. I felt just as good as I always did, and the numbers came down to practically zero, and they've been there for years. In other words, I was completely cured of that. I stay on a very slight maintenance program now with very little medication every other week, and my numbers are below 1, 0.09, for several years now. So, I mean, at first there were high numbers, and they got it down by trying different things, and all non-toxic, and it came down to below normal. So as far as I'm concerned, it's a great success story, and I've never felt better, and there were absolutely no toxic effects. And my oncologist had recommended radiation, and I just flatly refused to do it. That's when I went to the Revisi people.
What is your name?
My name is Leif Anderson. I live in New York City. And, well, for what it's worth, graphic artist and painter, you know.
Were you able to continue your painting?
Oh, yeah, sure. I mean, everything's fine. It's like nothing happened, you know. As far as I couldn't recommend it more highly. From all the other doctors, and I must say that my oncologist is very open-minded. When I see him still every 6 months just for a general checkup, he says, "What can I say? This is obviously working. It's amazing." So there you are, you know.
Can ask somebody else if they're going back and not necessarily challenging their physicians who ordered more aggressive treatments, but did the doctors accept to look at you and take it seriously? Or what has happened during Dr. Revici's life, do they consider that you are that one in a lifetime of spontaneous remission?
Well, I don't know about my urologist. He's amazed at the success of this, and he takes all the details, and he says, "I got to present this to the people at my next meeting when I meet these." I mean, I don't know how.
The reason I'm asking is your doctor or any other doctors have not sent us patients, and it's understandable, because in their own mind they feel that this is something just unexplained, nor do they stretch to find out what we do, how we do it, why we continue to do it decades after these treatments were started. So they appreciate that you're doing so well, and did nothing about it. Well, unfortunately. That is my experience with them, and I'm surprised. I don't know how, more than what we're trying to do now, how to bring it to their understanding, the fact that it works, or else you won't be here telling their stories.
Quite surprised and pleased, and he asked me what I take, and I show him, and he just sort of said, "Well, it's hard to believe, but it's obviously working." And he keeps saying he's going to present it to some meeting. But as far as I know, he hasn't done that. I saw him a few months ago. And each time he comes and, you know, he looks and says, "Oh," you know, like,